Can you hear me?
Yes, I can.
Awesome. How are you?
Good. How are you?
Good. I have to warn you, this is the first time I'm using this whole live system on my new computer.
Okay. All right.
It may take me an extra minute. And I was also
Okay.
just taking notes. I was like, oh, I should ask her this. And how do we know to refer? Okay. So the meeting's already being recorded because of my computer. I was like, okay, let's just start that and make sure we have a good recording and I can get, edit out the early part of it. So is there anything specifically you want to talk about on this video or just get the ball rolling on PA Navigate?
Um, I guess just get the ball rolling. I feel like with my answers, I might just cover different things that come up. So yeah.
Great.
Okay.
Okay. So my question is like right up front, like what's the purpose? What type of info can you get off of there? And then how can you use it? Because there's a personal use and also a client use, correct?
Yeah. Yes.
And then how, I love this kind of question. How do we know to refer someone there?
Yeah. So all good questions. So PA Navigate, I'm going to actually take it back a little bit, was
Great.
also known as findhelp.org. And then
I
before
remember.
that, it was known as Aunt Bertha. So it's no longer known as Aunt Bertha. It is now findhelp.org.
Wait,
Find
hold
Help.
on for a second. Let me
Yeah.
try to get the live so then you can start talking.
Oh, yep.
We don't have the live video yet. I'm like, wait a minute, this is all good stuff. Stop. Okay, so fingers crossed that this works and that the gods of the internet are on our side.
Oh, I got a message that says it's being live streamed.
Okay, everybody, hold on. We all know I love to check the BChip page just to see what's actually going on. Cannot switch there. Okay, we are getting notification that we are live streaming. It's not showing up on the BChip page yet on my end. Oh, it is. Good morning, everybody. Hello, this is Dr. Jennifer Gardella. We never really know what's going to happen with these. And I have on with me today the lovely Samantha Herrera from the BChip team. We are here to talk to you about PA Navigate. So Sam is very excited to talk to us about this. Sam, welcome. How are you doing this morning?
I'm doing good and I'm happy to be here.
Great. So you were, why don't you first just start off with a very clear explanation, and then we'll get into the history that you know so well of PA Navigate and how this thing has been built over time to give resources. What's the history of PA Navigate? What's it been called in the past? What is it? What's the purpose?
Yeah, so a lot of folks, especially when we go out to events, knew findhelp.org as Aunt Bertha. So that's kind of how it started, Aunt Bertha. And then that became findhelp.org. So findhelp.org is the organization that powers that software. So if you go to findhelp.org, you'll go to that software that we are promoting when we go out to community events and even when we're having our own meetings here professionally. So then what findhelp.org allows you to do is buy your own white label. And when you buy your own white label, you can name it whatever you would like. So a lot of the hospitals here in Bucks County who have Epic, they already have findhelp.org integrated into their EMR systems. And they have different names for it. So if you come up to someone in the hospital and you say something along the lines of findhelp.org, they might look at you a little confused because they have their own names for that software, but it is the same exact thing. And then to just maybe further complicate it just a little bit, the state of Pennsylvania decided they wanted a white label, and it is now called PA Navigate. So whether you use PA Navigate, whether you use findhelp.org, we like to say it is multiple doors leading to the same house. It is the same website, just it'll come up with a different logo and name, but it'll work the exact same way.
And what kinds of information can we find on there?
Yeah, so I like to refer to it as the yellow pages, but online. That's actually my favorite thing, my favorite line to use when I go out to events, especially a lot of folks who like remembered the yellow pages. They would be like, oh, well, that makes perfect sense because it's exactly that. It's an online directory. Whether you do panavigate.org or findhelp.org, it's going to take you to a screen that's going to ask you to put in your zip code. You'll put in your zip code, and then this other screen pops up, and you're going to be able to either hit different tabs which have, food, housing, medical, legal, those sort of categories, or it'll have a search bar at the top that you can just type in something very specific that you're looking for. And then all of those organizations or all of those programs that you're searching for or services will populate on the page, and you'll be able to look through them and see which programs maybe you may be eligible for, maybe some that you're not. If you find one you'd like to at least call to find out, their phone number, their location information is all there listed on their program card, is what they call it.
Okay, and so does it cut through any of the red tape in connecting with these organizations?
So that is the goal, and because we here at Beach Up, at least we have a lot of people who call and they're like, well, I'm not really entirely sure what Beach Up does, but it's called Health Improvement Partnership. Can you help me secure transportation to my medical appointment? And while Beach Up, or we don't specifically have programs like that, we like to use PA Navigate to refer them out. So either we go on there ourselves and we find some listings, some programs that could potentially help them, or we encourage them to use it themselves, only because they might be able to find something else on there that they were also looking for that was next on their list, right? So that would be
Right.
another phone call to who knows how many other places to just find where to get to. So we're hoping that this is going to streamline that sort of process for folks in the community where they don't have to be reaching out to all of these people for different services and kind of start in one place. And they can search for things as they need them, and then they can make those phone calls a little bit more intentionally. So, you're not kind of taking a shot in the dark. You're calling someone that more or less might be in that world that could at least either further connect you, or maybe
Right.
you just hit the jackpot and that's the one that's going to help.
Right, because you make a great point. I mean, so much of this is it's finding out what you don't know. And if you don't know that there's an organization that's actually designed to help you in your neighborhood, how are you actually going to find it? Right, that's
Exactly.
a big piece of it. So you may say, oh, and I also need this type of program, but you're not out there actively looking at it. Also, because you're trying to solve your first emerging issue, like, hey, we
Mhm.
need food and shelter. Okay, but now we also need a smoking cessation program like Beach Up offers, or
Yes.
help with drug and alcohol abuse, or any of the myriad, or healthcare issue. We have healthcare issues as well. So it's great that it's all in one place and people can really get a holistic view of, what it does and the services that are available. Why don't you talk a little bit about who can use this? Because I know it has a client referral system baked into it.
Yes. So, first and foremost, any member of the community, I'm going to use Bucks County because that's where Beach Up is based off of. So anybody
Sure.
in Bucks County can use it. There is no income eligibility there, that you don't, with insurance, without insurance, there's absolutely no sort of criteria to be able to use the platform. The really great thing about it also is even people outside of Bucks County, I like to tell them too, if you have family and friends in another state and another county, they can use it too. So it might be confusing if you tell somebody in, Texas, go to panavigate.org,
Navigate.
right? So I always tell them, if you're going to let any friends or family in another state know, it might just be a little bit easier to just say findhelp.org. Again, same thing, right? So um, they can use it all across the country. It is free no matter where. You can translate it into over 100 different languages. So you can customize it based on who is using it. And then on the other side, I like to say on the business side of things, you can also, hospitals use them. So, a lot of the times the goal is when somebody's being discharged from, let's say, the hospital, a lot of the times they'll go through some, a bit of a checklist to make sure that when they're being discharged into things that are going to maintain them healthy and not have to come back to the ER for something. So it might be something along the lines of food insecurity. Do you have somewhere where you can go get food? And if the answer, let's say to that is no, they can go right into whatever they're calling it in their system of findhelp.org and search for things like food pantries for them and give them that information. Or even a step further than that is send out a referral so they can go to, let's say, the Bucks County Opportunity Council and send a referral out to them and say, this person is in need of food, can you contact them for next steps? So that is what we're trying to do and get a lot of the organizations, either the hospitals themselves usually have their own programming where they have folks dedicated to the training. So, but we're always here, BCHIP's always here to help alleviate any of that work if they need, more hands, because, hospital systems especially so big. So we're always here to help for that too with trainings. But then the nonprofits in Bucks County who we would also like to get on the platform so they receive these referrals and are able to provide that loop closure, we are doing trainings for them as well. So the trainings are maybe somewhere from 30 minutes to an hour. You can train as many people as you would like on the call. And what we're trying to do is get them to accept these referrals, well, first of all, claim their programs, then turn on the referrals, and then start accepting them and moving through them. So we can at least provide loop closure. So when the hospitals refer someone out, they can see that that person they referred actually was spoken to and taken care of. And if they weren't by that organization, maybe they can see, oh, well, they weren't able to help them, but they got referred out further, and just kind of go down the line of, how that patient ended up being taken care of. So that's what we're trying to ultimately do with the platform.
Awesome. You mentioned an important something you said a couple times. I'm going to assume it's an important loop of closure. What's that?
Yeah, so when we say loop closure, we're saying exactly kind of that example that I gave of a hospital gives a referral out to somebody, and then that let's say to BCHIP, let's say they refer someone out to BCHIP for a smoking cessation program. It's going to come to me, and I will look at that referral. I will get in contact with that person because when they send the referral, it sends me their name, their number, any information I need. I give them a call, and let's say I do successfully sign them up for a class. That is loop closure. And then what I do is I go back into the system and I update it and I say, this person got help. I call them on this day, add whatever details I need to add, and let them know that this person was taken care of and they got help. Even if I or this organization couldn't provide that service and we had to refer them out and they got help then, that is still considered loop closure because it's almost, exactly what the word is. You're essentially closing that loop. So you're making sure that nobody in that loop is forgotten or, they kind
Right.
of fell through the cracks. We want to make sure that they get followed through all the way to the end. So whatever it is that they, whether it was food insecurity or they were trying to stop smoking, we want to make sure that they got the help that they needed to reduce any other, future issues that could come from that.
Great. Yeah. So it's making sure, like you said, no one falls through the cracks so that it doesn't wind up in, the red tape loop of non-closure, I guess you would say,
Yes.
right? Okay. So here's my big question that I always love to ask about programs like this. How do I know, or any of our listeners and watchers know, how do we know that someone needs help and can find at least a path forward in PA Navigate?
Yeah, I mean,
What are we
that
listening for?
So a lot of the times, especially at events, I'm going to just use that as an example because when we do a lot of community events, especially right now during the fall time. A lot of folks who come out to the events are looking for a lot of, specific things. And they come up and they'll say, not a lot of the times people don't very outrightly say, I need food, where is it? Right? They kind of just come up and they look at the table and they're like, what kind of programs do you offer? Or, are you looking, do you have, anything that might be, free or reduced cost? That's another thing I think I want to point out too, that a lot of the programs are on findhelp.org or PA Navigate, are free or reduced cost. I don't think up until now I have not seen a program that is at full cost. So that's a huge barrier for some folks too.
Oh,
So a lot of the
huge.
times that's an indicator, when someone comes up and they're like, is there eligibility criteria for this? Like, do I have to have a certain income level? That can also be an indicator to you that they might be looking for something that either has, a reduced cost or no cost at all, which is really great because on the platform, you'll find mostly that the majority of those programs are free or reduced cost. So A lot of the times it's just the phone calls that we get here at BChip, where can I find this? Where can I find that? I kind of lead them in the direction. Sometimes it just leads to an impromptu training over the phone of how to use it, which is perfectly fine. So I always like to tell when I'm out at events, I tell folks, if you can't figure it out, that's not an issue. Just give me a call. We'll do it over the
Well,
phone. I'll look for things for you and give it to you over the phone, or we can just do the training over the phone and work it out that way. But yeah.
that is fantastic. And I'm also going to say that these types of systems are phenomenal. If someone you love is struggling and you need help with that issue that they're struggling with, meaning you need support helping them through, right? So even just knowing that the programs are there and you can pass information along to your loved one who's struggling with whatever, housing, food, a medical issue, know that the resources are at your disposal in PA Navigate, which I almost just called Find Help.
Yeah.
Okay, so Sam, why don't you just wrap it up about
Yeah.
PA Navigate?
So, I guess if I were to leave anything with anyone, it's that this is something that is open to all, and there's no reason that nobody should feel that they couldn't be able to use this platform, whether they use it themselves on their computer and their phone, or they give us a call and we do it for them. I do want everybody to know that this is open to everyone. That's a lot of the questions that I get, am I able to use this? Am I allowed? It's really the question that I get. Am I
Right.
allowed to use it? Right? Because it's almost like, how can this possibly be? Like, how can I just go on here and find all of these resources? Like, is it really that easy? And I don't want to say that it's easy, because of course our job, if we're doing it well, is we're getting all of these organizations claimed so they know that they're on this platform and they can make sure that this information is up to date. So that's something that if we're doing our job well, we're going to continue to do, so folks can feel like it is that easy. I really want it to feel like that. I want it to feel like it is that easy to just go on this website that someone told you at an event, and you can just find all of these resources for you to help. There is no reason to not use it. All the resources that are here to help you and keep you healthy, because that's essentially what BChip is wanting to do. We want to keep everybody healthy. We want to make sure nobody falls in between the cracks. So I will always be, PA Navigate's biggest supporter. It's one of my favorite programs to talk about. And I really hope that everybody could just, even if you don't need something right now, just go online and play around with it, because you don't know if in the future you or a loved one might need it. And you're going to want to be prepared with that information. It's going to feel really good when someone comes up to you and you're like, I actually know what to do. Like, I know where to go. That's a great feeling. So
Right.
if anything, I just really want folks to know about it and just play around with it, just see what's there and what could possibly be used for the future.
Fantastic. So if you've lost access to food, access to housing, access to healthcare in some way, and I think a big part of this also, and we all know at BChip that, Kim is such a big fan of mental health. Sometimes the anxiety of not knowing where you're going to turn is the biggest problem. And BChip, Samantha specifically, as well as the PA Navigate system, they are here to help you navigate so that you can stay healthy in Bucks County. That is the goal. Well, Sam, thank you so much. We've had you on before. We really appreciate your time, and come back to discuss any other great things that are popping up in the BChip healthcare world of Bucks County in the future.
Awesome. Thank you.
Bye.
Bye.